Welcome to the Deep Dives. We take your sources, dig right into the details, and hopefully bring you the important stuff without all the overwhelm. Today, we're looking at some notes, some excerpts, really focus on understanding how depression actually gets diagnosed. For a lot of us, depression might just mean feeling really, really sad. But how do mental health professionals figure out if it's actually depression and not just, say, a really rough patch? Is there some kind of magic blood test? Can you be, too young? We're going to unpack all of that.
Yeah.
Our mission today really is to cut through some confusion and give you a clearer roadmap of how this diagnosis thing actually works.
Yeah, and what's really interesting right away is how the sources draw this very clear line. Depression is fundamentally different from just feeling sad, after a bad day or being a bit moody. Everyone feels down sometimes, that's normal. But depression, that's a persistent mental health condition. It impacts your thoughts, your feelings, energy, sleep, even your body. And the key thing, it lasts for weeks or even months at a time.
Okay, let's dig into that distinction a bit more. The source actually gives this really helpful analogy. Feeling sad is like getting caught in the rain, right?
Okay.
But depression is like living under this rain cloud that just won't leave. It's that persistent quality that really sets the stage.
Exactly. And that persistent rain cloud, it's not just that it's there, it changes everything underneath it. What's really crucial to get here is, even if you have a good day, maybe a little glimmer of hope inside those weeks or months, true clinical depression doesn't just vanish like a normal mood swing. It's the persistence of the whole pattern, not, the total absence of any okay moments. That flags it. That's the tricky part about that rain cloud. It might seem to lighten up sometimes, but it doesn't really go away on its own, not without help.
Right. So it's clear telling the difference isn't just about a feeling. It's about this pervasive grip it has. So, okay, once you recognize maybe there is this persistent cloud, the next big step is finding the right help. Which brings us to, who actually makes this diagnosis? Can you just, go to any doctor?
That's a really important point. It's always a trained mental health professional, always. This isn't something just anyone can figure out. The sources list specific folks. It could be a psychologist, they focus on evaluations, therapy, or a psychiatrist, they're a medical doctor, so they can prescribe medication too. Even your family doctor or pediatrician, especially for teenagers. And of course, a licensed counselor or therapist can diagnose too. These professionals, they have specific training to look beyond just mood and use these established, pretty rigorous guidelines.
Okay, so you might think diagnosing involves some, high-tech test. But the real power, it sounds like, is simpler, maybe more revealing than a lab result. So when you do connect with one of these trained pros, what does the actual diagnostic process look like, step by step?
Yeah, it's definitely systematic. Usually involves 3 key steps. The first one is basically asking questions.
Questions. Okay, but not just, how are you feeling today? I imagine they go quite a bit deeper.
Oh, much deeper, yeah. And it's not meant to be, scary or nosy. It's just essential for them to understand your specific experience. They'll ask things like, so how long have you felt down or low? They'll get into changes in your daily life, asking, are you sleeping way more or less than usual? Or about focus, are you having trouble concentrating, making decisions? They'll also ask about enjoyment, Have you lost interest in stuff you used to like, things that brought you pleasure? And physical changes like, how's your appetite been? Has your weight changed much without trying? Then they might move into more sensitive areas, asking, are you feeling kind of hopeless? Or life doesn't really have meaning. And crucially, have you had thoughts about hurting yourself?
Wow, okay. With questions that sensitive, it must be hard sometimes for people to be totally honest.
Yeah.
How do professionals help with that? Make it feel safe?
That's a really good point. The best ones, they really focus on creating a safe space, non-judgmental. They emphasize that it's not about judging you, it's about understanding your experience so they can actually help effectively. They know honesty is just paramount because those answers help them see the full picture of what's going on.
That sounds incredibly thorough, like piecing together a really complex puzzle. And after all those questions, is that when they, pull out a test? Or a scan or something?
Well, not a blood test like many people imagine, no. But they do use a kind of clinical checklist. That's the second key step. And it involves something called the DSM-5.
Right, the DSM-5. If you've looked into mental health at all, you've probably heard of it. But our sources really show how it's used practically, not just like a textbook on a shelf. How does it actually guide the diagnosis?
Yeah, think of it as the definitive clinical standard. It's this living document. It keeps evolving as we learn more about mental health. It's basically the rule book that helps ensure diagnoses are consistent, everywhere. So for what's called major depressive disorder, the DSM-5 says you need to have at least 5. 5 out of 9 specific symptoms. And this is critical. These symptoms have to last for at least 2 weeks straight. And they have to be interfering like significantly with your everyday life. Things like school, relationships, even just basic self-care. That interference part is really key. It's not just having the symptoms, it's how they impact your ability to function.
Okay, 5 out of 9 specific symptoms, not just any 5. Can you walk us through those 9? What are they looking for?
Sure. They kind of break down into a few areas. First, the core emotional stuff. Feeling sad or down most of the day, nearly every day, or losing interest or pleasure in pretty much everything you used to enjoy. That's a big one. Then there are these significant physical shifts, big changes in appetite or weight, up or down, sleeping way too much or barely at all, feeling really restless, agitated, or the opposite, really slowed down, like moving through mud, and feeling super tired, like no energy all the time. And finally, there are the more cognitive and self-perception issues. Feeling worthless or excessively guilty, having trouble thinking clearly, concentrating, making decisions, and again, critically, recurrent thoughts of death or self-harm. You only need 5 of those 9, remember,
Yeah.
but they have to be there consistently and really messing with your life.
That's a really comprehensive list. And you mentioned something earlier about making sure the symptoms aren't caused by something else. Does that lead into the third step? Because I have heard about physical exams or lab tests, which honestly feels a bit surprising for diagnosing something mental.
It does seem unexpected sometimes, but it's actually a really important third step in a thorough evaluation. The reason is basically to rule out other things first. To rule out any underlying physical problems that could actually be mimicking depression symptoms. For instance, thyroid issues can do that. Certain vitamin deficiencies can too. Even side effects from some medications. So a professional might order a blood test, yeah. They'll definitely ask about your full medical history, review any current meds or substances you might be using. The whole goal is just to make sure your symptoms aren't coming from something physical that could be treated before they land on a mental health diagnosis.
Well, it makes so much sense. It really shows how careful they're trying to be to get the right picture. Now, the sources also mention that depression can look different depending on your age. Specifically for teens, how might it show up differently for them?
That's true, yeah. Symptoms can present quite differently in teenagers compared to adults, which makes getting that professional assessment even more important. So instead of just seeming sad or withdrawn, a teen with depression might actually come across as more irritable or angry even. You might see them suddenly stop hanging out with their friends, or their grades might take a nosedive at school. And interestingly, they might complain more about physical stuff, like headaches or stomach aches, even when doctors can't find anything physically wrong. And sometimes, what looks like laziness in a teen, it could actually be them feeling totally numb and just utterly exhausted because of depression. So the message is, if you're a teen and something feels really off, it's completely valid to speak up. Diagnosis and treatment are definitely possible for your age group.
That's such vital information for parents, teachers, and for teens themselves. Okay,
Yeah.
so clearly it's a complex process, this diagnosis. It's nuanced, built on careful listening and questions. Let's tackle some common myths now because there's just so much misinformation floating around. First one, the big one. Is there a depression blood test? Like yes or no?
Yeah, we hear that a lot, and the clear answer from all the sources is no. There isn't a specific blood test for depression, or a brain scan for that matter. Mental health conditions, they aren't diagnosed like, say, diabetes or a broken bone using those kinds of tests. They're diagnosed by understanding a person's lived experience, their symptoms, like we just talked about with the questions and the DSM-5 checklist.
Okay, so no simple blood test. Got it. How about this one? Being depressed means you're weak or somehow broken. I unfortunately still hear that sometimes.
Yeah, that's another myth that just hangs around, and it's fundamentally wrong. Being depressed does not mean you are weak or broken. Not at all. It means your brain is struggling, just like, any other organ in your body might struggle sometimes. The source had a great analogy for this. It really helps clarify it. Think of it like a sprained ankle. It's an injury that needs care and healing, right? It's not some sign of a moral failing or personal weakness.
A sprained ankle, I like that. Okay, and the final myth. Can you just snap out of it? Just decide to cheer up and it'll go away if you just try harder.
Unfortunately, no. Absolutely not. You cannot just snap out of it. Depression is a real condition. It requires support, it takes time, and often it needs professional help, whether that's therapy, maybe medication, maybe both, to manage it and actually move through it. It's definitely not a choice or just a matter of willpower. It's a medical condition needing proper care.
Right. So, okay, someone goes through all these steps, the questions, the checklist, the physical check, and they do get a diagnosis.
Yeah.
What happens then? Is it like this final awful label, like you're doomed? Or is it Something else.
Yeah. Absolutely not a doomed label. The sources are super clear on this. A diagnosis is actually the first really empowering step towards feeling better. Because now you can get targeted, effective help. It means you can start therapy, maybe talking to a counselor each week, or you could explore medication if that seems necessary and appropriate for you. It also means you can start learning coping skills, getting the right kind of support from family or school or friends, and maybe most importantly, you can start to actually understand what's really going on with your brain and your body. So, diagnosis isn't just some label, it's framed much more as a tool to help you heal and, reclaim your well being. And if we kind of zoom out, connect this to the bigger picture, what really stands out is that diagnosing depression isn't about judgment. Definitely not about shame. And it's certainly not about guessing. It's a process that's really rooted in deep understanding.
Yeah, it's fascinating how much actual human connection conversation, skilled listening, just a caring ear is right at the heart of it. Even with all the criteria and the physical checks, it really is a process built on understanding your unique experience. So, what does all this mean for you listening right now? If you've been feeling off or low or just stuck for a while, especially if your body feels it too, remember those physical symptoms we talked about. The takeaway here seems really clear. You don't have to figure this all out by yourself. Reaching out isn't weakness. It's actually a really profound act of self-care.
Yeah. And that brings up maybe an important question for you to think about. If getting real answers, real understanding can lead to real help, what might be that first, maybe brave step you could take towards gaining that understanding about your own well being?